The other thing I want to ask is how accessible is all this stem cell? I mean, I was reading this article in The Atlantic. They said the secret to having great skin is being rich, right? And it's kind of true, right? The people who are writing these articles and selling these products, they have access to laser treatments, and it's not just about putting some goop on your face, every morning.
Yeah.
So let's talk about stem cells and how accessible it's going to be.
I think that's, unfortunately, the cost is high just because it's not mainstream. And so, but I think, with even the project that we're building, the beta project name is called Impact Health. Maybe we may rebrand it later on. I kind of divide things into biohacking 1.0 and biohacking 2.0. And really the 2.0 is kind of the stem cell stuff and the really peak performance stuff. But you can get into biohacking pretty easy at an accessible level, which can affect stem cells, right? Like the cold therapy. You don't even have to do cryo. You can just fill your tub with ice and water, and there you go. You can just do some online courses that Wim Hof has online and do that, and that could technically influence your immune system and stem cells. You'll get more from that than, let's say, trying to do just some one-offs. In terms of stem cell therapy, I think the price is a little bit high now. I think as we get more technology and there's more competitors in the area, the price will go down. So I don't think it's out of the reason, of actually comparing to if you were to go on vacation, or, if you want to go to Tulum, just skip Tulum this year, or things like that. I think we all make choices on what we want to double down on. And so I think it gets to the point of, if you just skip a vacation or a trip, that there's your treatment,
Yeah, and heart transplants, by the way, are super expensive. And so for people like my sister who, suffered from that, just wondering if it's going to be accessible for people who are waiting for new organs, because they're on a waiting list, and if they don't get it, they're going to die.
I think that's probably just a whole other bucket, outside of even the stem cell world. The idea of 3D printing organs is probably still quite far away in terms of actually using it in a person.
I read an article that said we were 5 to 10 years out.
Yeah,
from being able to,
which is pretty long time,
Yeah.
And they might be very limited. I know they're doing some 3D printed heart valves and whatnot, so that's pretty interesting. But I think anything could change, if healthcare collapses because, you don't have enough people working, and then Medicare doesn't have enough of, people in the workforce to sustain it, what happens? All this chronic sick care, which is actually the largest component of our consumerism in terms of healthcare dollars, that becomes the problem. So I think the idea is, yes, how do you fix these complex things like heart transplants, which are super important, but then on the flip side, how do you, I think your sister was a little bit more of an exceptional case, unfortunately, but the idea would hopefully be to get better diagnoses and treat things early before they become these big problems. Which is why I philosophically changed a large part of how I practice medicine.
And what's your philosophy?
Really it's well care.
Right.
It's a whole picture. I usually ask people, sure, what's bothering you? And then I say, what do you want to be better? And I don't think our doctors ask you, what do you want better, or what do you want more of? Right? It's kind of like, what can I fix?
Yeah.
So,
and I just have 20 minutes to spend with you.
Right, if you even talk to the doctor. A lot of times it's a healthcare provider extender.
Right.
So I think that model is changing too, especially with Google and the internet. People come to you with their own answers half the time, and they kind of come in saying, this is what I think I should get.